There we go. I didn't record that. 1 second. There we go. So recording? Yes. Okay. Okay. So other specific disorders. So some things that are kind of what I would say others. Oftentimes, like I said, in adult rehab, we are mostly doing aphasia and right hemisphere disorder. So a couple different things I want to say about that is it's kind of underreported. And that's for a variety of reasons. I think sometimes it's not well diagnosed. It's not, they're not usually referred to speech, and they don't necessarily have some of the language components that we see. So right hemisphere disorder, but I think we're getting better, and with better brain imaging, I think that it is getting diagnosed more regularly. And non-dominant strokes are now referred usually for a swallowing or motor problem, or they've had a history and they had either a right side stroke and now it's a left, and definitely maybe do have some communicative difficulties. And oftentimes we do begin with a aphasia assessment tool. So we typically, anytime anybody who has any kind of stroke, TBI, anything like that, definitely looking at doing some type of aphasia assessment. So oftentimes, sometimes people with right hemisphere disorder can oftentimes not, look like our other patients with aphasia. So they usually don't have a short-term memory span. They can follow directions. They can usually have decent word comprehension. But sometimes when we're looking at, it's more subtle, like we'll notice some things, but it's not that severe. So oftentimes we'll have some of these difficulties, but it's real subtle. So it's not as prominent, and we don't see some of the word finding issues like we do in our more non-fluent aphasia patients. And definitely we'll see more problems with lexical semantics than with phonology or syntax. And really, basically, it won't be noticeable. It's like sometimes we'll notice it. It's not as overt as maybe aphasia. So kind of looking at primary cognitive impairments caused by right hemispheric stroke. So, oh gosh, I never can say these right. Anosognosia. So they don't recognize that there's an issue. So they lack insight, they lack awareness, they lack that they're having difficulties. And they'll deny it. They'll say, I'm doing fine. Sometimes they argue the fact that there's something going on. And then it's usually observed as lack of awareness of paralysis. So sometimes we'll see that some paralysis that they have issues with. So you kind of look through some of this. There's some specific that, so left neglect is more common than right neglect. So that's a visual thing. So if you're not familiar with what left or right neglect is, definitely look that up and kind of be familiar, because you'll see that quite a bit in our in neuro rehab. Skilled nursing facility, definitely left neglect, right neglect. And then auditory agnosia, impaired ability to recognize sounds. So they're hearing stuff. So they might not recognize. So it seems like they've got hearing issues. So there's emotion complexities. So definitely there's some changes with that. And then they tend to omit or misread words on the left side. So they have some of that left visual issues. So, and again, before they weren't really, what I would say, diagnosed properly, and definitely some issues with that emotion and prosody of it. So maybe the flat affect or monotone. So let me go back. So look through this. There's a lot of different things. Like I said, the right hemisphere is more subtle. Then the other part I want to talk about, the other disorder. So like I said, right hemisphere, you'll see it's not that common, or you might suspect someone has some right hemisphere, but they're seeing you for a different issue. Transgender. So let's go to transgender voice therapy. So this is a newer thing. There's transgender voice therapy. I have never done this. I don't know much about it. I think it's a newer up and coming part that SLPs and voice clinics are doing. There's definitely some things to say that some of the hormone treatment that they do for a person who's female transitioning to male, oftentimes the hormones themselves change the voice. It's a little bit different when they transition from male to female. So definitely some things that they do work with some therapists who specialize in voice. And there are some people that really specialize in transgender voice therapy. And obviously there's components that are what we call masculine and feminine. And there's components of our voice that are characterized with those genders or gender stereotypes, if I should even use that word. But definitely there's some nuances and things to make someone sound more feminine or someone to sound more masculine. Nice part is that it often, typically, what we see is that it's the male to female transition that, you know, they've already had some of those male components, they've already had exposure to those hormones. So that's a little bit more of the demographic. And there is a one second. There is a transgender voice therapy observation. So that's a new one that they added to just in the past year to Master Clinician. So at least that's something new. Hopefully you haven't watched it before. If you have, it'll be a good refresher. But like I said, I watch it because I'm not really, this is one area that's definitely new to me. I've seen some right hemisphere. I've seen obviously aphasia. I've seen a lot of other issues, but transgender voice therapy is not something I am as a clinician familiar with. So I've been learning a little bit about it, but let me go to the reading review summary. So kind of looked, you know, what did you learn about people who are transgender? What did you find interesting? So obviously there's actually a lot more information about this than there was even a few years ago. And it's kind of a niche that there is, I think, 1 or 2 therapists in Phoenix who really specialize in this. And also too, when we're looking at that whole, that's a bigger, broader scope than just the speech therapist, obviously. But they're kind of a member of the team. So if somebody transitions, definitely that's, like I said, learning more about it as I was looking up information and trying to get knowledgeable about it. There is here. So let me go to the ASHA page. And ASHA's getting a lot more information. I think we're getting a lot more research about it too. So, and you got to think too, voice is kind of a component of people's identity. So when we're talking about how people view themselves, that's kind of a component of that. So I find that a little interesting too, because, you know, I'm trying to think of how I'd feel if something happened and my voice was dramatically altered and I sounded different or people didn't recognize me, that kind of thing. So definitely some pieces there that are broader. That's a little bit more what I would call the bigger scope of cognitive behavioral therapy, but definitely voice is part of our identity. So I see why that's becoming more of a recognized need in our field today. But let me go to the read and review. Hang on, don't I have the, 1 second, sorry. Sorry, hit the wrong one. This is when I was on, no. So this is from Asha. So some of the things that you work on in voice. So it would be the same just if you were in voice therapy, obviously with some different purposes: pitch, resonance, intonation, the rate, volume, or kind of the nonverbal part too. So there's definitely some nonverbal components, and the therapist working on that will help, help the client work on some of those components. So we do know that there's things for female pitch, female intonation, rate and volume, and then there's things that I would say are not as gender specific. So kind of work on those nuances. So it's a lot more what I would call highly sophisticated voice adjustments to change those. So now a lot of people would say, okay, your pitch is, your pitch is where it's at, your resonance is what it is. And that's not necessarily true. There are things that you can do to alter some of that and adjust. So I'm not, like I said, voice therapy is when I've done minimum. I do more vocal hygiene stuff, but definitely there's some nuances that are gender specific that we can work on. And then kind of the other viewpoint is how the transgender community finds voice therapy finds a voice through speech therapy. So what's their views on it? Is that something that's a need? So what I am learning is it seems to be a need that they want. So people are transgender oftentimes do seek this out, but maybe in the past have had difficulty finding a therapist to work on those skills. So definitely some things that I found this read particularly interesting and I'm learning. And the hormones do alter our voice. So hormones, whether you're taking male or female hormones, can alter certain aspects of our voice. So definitely some things. I do want to say, as I was reading in just telehealth update, that some of these specialty niche areas of therapy that maybe we don't have as many clinicians who are well skilled in it, Zoom and telehealth is helping people get access to that. So that's what's exciting also, is that people are getting access to the help they need and are able to find therapists who can provide the type of therapy they're looking for. So definitely, and oftentimes, as most of you know, although I think this goes for a lot of things speech-wise, is it's out of pocket. There's not, it's not something insurances cover. So definitely some things to think of there. But the nice thing about telehealth, this is just not voice therapy, this is all therapy speech-wise, is it might be more cost effective in certain ways than travel and accessibility for families, for clients, as well as the therapists themselves. So for instance, as a therapist, when I worked in Kentucky, I serviced what we call an underserved population. Well, considering, I can only make it to so many houses in an area span in a day, but I might be able to have more clients in a day in telehealth, or, hey, I can go here and here, but then the next person's like 35 minutes out. And that's an extra hour in drive time that takes away from my productivity. So is it beneficial? Obviously not everybody under the sun is appropriate for telehealth, But in some of these populations, especially when we're working with the families too, sometimes it is more, you know, bang for your buck, so to speak. Is this the one I pulled up already? Oh, that one's not working. Okay. So I said, somebody else asked me a question. And I'm like, I'm not even sure. And anybody who's really interested in voice, yeah, it's underrepresented, but I'm learning it's increasing. And to be honest, when we look at voice therapy in general, these are all the things we do with your average person, not just transgender voice modification, breast support, speaking rate, vocal health, volume and intensity might be a necessary thing in not just transgender voice therapy, just in voice therapy in general. So sometimes, one, I was reading this blog from an SLP talking about how they were having voice problems before, and then they are going through transition and some things kind of escalated, and definitely they engaged in just some poor vocal behaviors in order to sound different. And then that wasn't healthy for their voice in general. So definitely some things too that I guess there's a lot of, they're at risk for vocal abuse. And that kind of made sense to me also. If you're talking in a higher register or trying to on purpose, that might be some challenges with your voice. So there's some read and review. There is, so read it, lots of, there's the right hemisphere video reaction. So these are just kind of little videos. So it's on the discussion board. Be sure to look at that. Sorry, I call it an observation. It's really short observations with a discussion board, as well as a quiz, and then the transgender voice therapy, and then the read and review. So definitely look at those websites. There's a lot of good information about that. Right hemisphere, you're going to start to see more of. So if you're interested in adult rehab, I think we're going to see more people referred for a right hemisphere disorder than we ever have in the past. So the nice part is like I said, with better brain imaging, you know, now I think is protocol, they give you they give you a CAT scan, they give you an MRI if they have any concern. So I do think we're going to see more referrals into speech therapy for our people with some right hemisphere disorder. And I think just because there's awareness and, like I said, just better diagnosing of issues, we'll see more of those. We'll see more people come to us with that diagnosis. And of course, when in doubt, you know, ask your supervisor. And I think things like left neglect, right. So if you look up left neglect, which is what we see often, right neglect, and kind of be familiar with some of those visual fields. So definitely do know adult rehab. And I've kind of talked with some of our colleagues. I think because we don't ever have to diagnose it, it's not something that even as clinicians, even as your supervisor, it's just something we alert others to. So there's other people who make those diagnoses. But when you're working with someone, so sometimes you'll have someone referred for cognitive rehab because they're not real sure. They just know maybe therapy will support them as they maybe are going through tests or they're going through some diagnostic rule outs. And what you'll see is sometimes people don't realize that it's more about the visual field. So when you're working, especially adult rehab, you'll notice people aren't going to the left side or the right side, or seems to be some pocket that they aren't able to see. Or when I talk like visual fields, sometimes they have like a impairment with the upper visual field versus the lower, or lower versus upper. And then you'll just notice as you work with somebody day in and day out, they seem to have difficulty seeing things over here. So I was joking to my coworker, I must have knocked 4 things off my desk, off my table the other day. And I was like, oh my goodness, I'm getting some right neglect over here. And we were just kind of giggled because her daughter has had some left neglect, and we've been talking about that. But we were just saying, and she was talking about working with the PT. So this might be something, if you notice, you've got to alert your supervisor to make sure someone has note of it. Usually you will see it in a report. Usually it is noted before you as a therapist gets that person. But oftentimes what we also know about somebody who's maybe had a stroke or something along those lines is that they might have had their first initial and now they're having some additional things. So I can't remember, I canceled, I changed office hours another night. I don't know, it's all blending. I'm not real sure when that was. My husband, his aunt, she had a stroke. We had some people come in town unexpectedly, and she's down in Tucson. And yeah, so she had a pretty significant stroke, and that was kind of sudden and out of the blue. So we had some people and, lots of hustle and bustle around for some emergency things, because we had to get some things together for her family, and other happenings around the family that was kind of unexpected for us. But just talking with them about rehab, stroke rehab, some of the things that will support them. It was good, at least I have the knowledge, and just helping, reassure them, what can you do to help and support a person. But definitely some things that they were just talking about right away. I was like, oh, make sure they look at, her visual fields. Sounds like maybe there's some left neglect going on. And definitely, yep, there was. And I said, just being aware of it is helpful, because I think sometimes we miss it. And depending on, did this person go in? Who are they seeing? Who's reporting the information? So oftentimes, sometimes what we see in our adult population is that we don't necessarily get good reporting of information, or versus a child, where you usually have parents and other caregivers involved and see it, versus adults who are typically taking care of themselves, and maybe have a spouse there or not, or maybe have other family members that are close, but not necessarily in their house every day. So sometimes what happens is there's not always a good reporting of symptoms. So if you see something in adult rehab that you didn't see note of in the eval, that's definitely things you need to alert your supervisor for, because sometimes it is like putting together a puzzle, especially with somebody with right hemisphere. Definitely there's some of that. And then, like I said, I'm not really familiar with transgender. It sounds pretty interesting, actually, but that might be if you're working out with outpatient with a close to an ear, nose, and throat specialist, someone who does a lot of referrals to an SLP out of an ENT clinic. So oftentimes those voice therapists work out of an ENT clinic or closely alongside in the same, medical complex. Definitely some things there that if that's your interest, I think that there's a big up and coming niche there. And then voice in general too. I think we have a low ratio of voice therapists. So I know in my other class, we're talking about musical, integrating music into therapy. Boy, I didn't get the music gene at all. So voice therapy, all that stuff intrigues me, because I'm not as familiar with that. But if that's kind of an area that you seem to have knowledge, that might be a good niche to get into. So reach out to those therapists working out of ear, nose, and throat specialists. But yeah, I don't even know if ASU has a lot on transgender. I know Indiana University did, but the Kinsey Institute was there before. So my undergrad, where I did in the 90s, there was, we did have one person there that did some of that, but like I said, different time now. So definitely it's more of an awareness and better understanding, I think, as a whole. And I think our field is trying to come up with the times and get with what do these people who are seeking the voice therapy, what should be our target for therapy? What's the evidence-based practices involved in that? I think that's where it's kind of, I don't know if we have good data, but it seems like they're starting to get some better data with that. So that's this week. Any questions?
I do have a question. For the quiz, it's just going to be the right hemisphere topic, nothing on voice therapy.
I'm gonna say yes, but you know what? So we made some updates not too long ago. I'll make an announcement and I'm pretty sure it's just right hemisphere. But I will double check on that. Thank you. That's a good question. To be honest, I should know that off the top of my head, and I don't. I think it is. I think it's just labeled right hemisphere. So if it's not, I will make a note on the announcement page.
Okay, thank you. And
Okay.
also, I do have one question regarding module 12, the
Sure.
therapy ideas. I'm sorry, but for the aphasia therapy ideas, it says review the 6 sites for free speech therapy materials, but
Mhm.
there's only one site. And
Oh,
when I
okay.
go to the site, it
Did
has
let
like
you in?
5.
Did the site let you, could you get into the site?
I could get into the site, but it says 6 sites, so I'm not sure if
Oh, and it might be, that should have maybe been changed.
I
Yeah,
had
there's
that
lots of
problem
stuff
too.
taken down. And then this past year with COVID, some of the more free sites that used to maybe be funded, I think have been down also. I will double check that. Was that on module 12?
it is, yes.
Okay, thank you for alerting me to that.
I think what most people did is they just found the information randomly. It's okay.
And
to
that
look at
works
that,
too?
I assume.
That works too. I'll look at
Okay.
that. Thank you for pointing that out. I do know there were some things that have been taken down that used to be free. There was just one I just went to actually last week. I will check on that. So module 12. Okay. Thank you for the update. Okay. And you said it was on which one? On module 12? On which assignment?
It was the therapy ideas, aphasia therapy ideas.
Oh, therapy ideas. Got it. Okay, yeah, there used to be 6. I think Tactus just has that one now. They used to link to other ones. So, all right, I'll fix that. If you found information elsewhere, that's okay too.
Okay, so any other links are okay?
There used to be 6 when you used to do the first one. Tactus used to link to a lot of other ones. But it hasn't. It must have taken those down. So 1 second. Oh, there we go. Yeah, I'll fix that for you guys. But if you found it elsewhere, that's okay. That's not a problem.
Thank you.